US health insurance plans, healthcare in US, learn more about life abroad. Here we visit the site. Navigating the US healthcare system. The COVID 19 pandemic has significantly impacted travel and immigration to the United States. Please refer to this article for the most up to date information and links to official sources. Ask almost anyone who has lived in the United States, and they will have a health insurance story to tell you. Even if they don't, they most certainly know someone who does. Health insurance is notoriously expensive and complicated in the US, unlike Canada, most of the Europe, and many other countries where universal health care provides a basic level of coverage to all citizens. The US has a mixture of private and two kinds of government run programs. Basic coverage in California and Florida can cost $440 per month, while similar plans in New York can cost upwards $600 per month. Healthcare 101. The public programs known as Medicare and Medicaid are specifically designed for the elderly, people with disabilities, and low income families and individuals. Everyone else needs to obtain private plans, either through their employer or on their own. Without one, you will still get treated in an emergency, but you are responsible for all of your medical expenses, and the bills can be astronomical. Even when you do have an insurance plan, you may still get surprise bills. Most insurance plans require you to make co-payments at every doctor and co-insurance. The percentage you pay alongside your insurer can come as a surprise to many forgiver foreigners who are not used to the system. Here's a guide to help you prepare for navigating the labyrinth of American health insurance and a few tips on what to do before you move to potentially save on medical costs. How does insurance work in the US? Private health insurance is either offered through your employer or school, or you have to buy it on your own. You can select a plan that suits you best from the ACCS Health Insurance Marketplace. The ACCA, which stands for the Affordable Care Act, is nicknamed Obamacare, provides subsidies to those who can't afford high premiums of insurance plans. The size of the subsidy depends on the individual's income. Some states like California, Colorado, New York, and Massachusetts run their own healthcare exchanges. The world of health insurance also has its own language and an extended glossary. It helps to learn a few of the essential terms in order to understand the plan you're buying. Premium, the most monthly cost of your plan. Deductible, the amount you pay out of pocket before your insurance kicks in. Co-insurance, the percentage of cost you still need to pay after your insurance kicks in. Co-pay, what you pay the doctor at every visit. Cost of health insurance varies widely and it depends on the type of benefits you choose. Usually, plans with higher premiums cover more of your medical expenses. In 2018, premiums averaged $440 per month for individuals and $1,168 per month for the families. How do I get covered? If you are employed by US company, you are likely covered through an insurance plan offered by your employer. Some employers pay for the plan in full, while others may pay part of the fee to and require you to pay the remaining cost. If you have a work visa but plan to self-employed, you will need to purchase health coverage yourself. You can find a plan in the ACCS Health Insurance Marketplace during the enrollment time, typically running from November to December for the following year. If you arrive to the US outside of the enrollment period, you may still qualify to apply because of your special circumstances. If you are a student or exchange visitor, F1 and F1 visas for international students On F1 visas, most schools require proof of health insurance prior to enrollment and typically automatically enroll students into their own student health insurance plan upon registration at the start of the semester. The US require all exchange visitors, J1 visa holder, and the complying spouses and children to have medical insurance. You can obtain an insurance plan through your university healthcare moving checklist. By planning ahead, you may be able to save some medical expenses. Here's a general timeline to keep you on track: 12 months, 6 months, 3 months, 1 month. HSBC commissioned this article. The views and opinions expressed are those of the author and do not necessarily reflect the views and opinions of HSBC too. 12 months. You should try to address any existing health issues and medical needs. Also, schedule any surgeries or procedure you may need before you move. 6 months. In this, contact your employer school to make sure you understand what your insurance options are. If you still need to find coverage upon your arrival, contact your current health insurance provider. You may be able to arrange coverage from an insurer in your home country for your first year abroad. This will give you ample time to find your US provider after your arrival. Alternatively, you may consult insurance expert to learn about national plans that will cover you in your destination country. 3 months. Pay a visit to your dentist if you wear glasses. Don't forget any eye checkup. Even if your future American plan includes dental and vision care, you may still save money on co-payments if you take care of it at home. Month, 1 month. If you are on my medication, renew your prescriptions and get your refills to cover you for when you are in the US. HPC commissioned this article. The view and opinions expressed are those of author and do not necessarily reflect the views and opinion of HSBC. Here's some quiz. Your American adventure moving to USA, whether you have a family or a foodie, this quiz will help you find your next American home. Discover America. City cards. The Great American City Cards. Cities in the United States are as varied as the landscape. Learn more about 8 unique American cities written by the local that know them best.